Well, the struggle to find a GP who bulk bills continues and is getting worse for certain groups, according to new research by free online healthcare directory Clean Bill. It's found that 87% of electorates have seen a decline in bulk billing this year for new adult patients who don't hold concession cards, with the electorates of Burt in Western Australia and Cook in New South Wales experiencing an almost 50% drop in the practice. The report also found that 9 electorates have no bulk billing at all. These numbers are at odds with government statistics, which find GP bulk billing has risen 2.1 percentage points in the first 2 months since the government tripled the bulk billing incentive.
Dr. Kien Seng Lim is a former AMA president and a GP who in fact bulk bills in Western Sydney, and he joins us now. Kien Seng, thank you so much for joining us this morning on Weekend Breakfast.
Thank you for having me.
If we can just start from the results from this Care Directory Clean Bill. The quotes are that it shows a decline in bulk billing, as we just mentioned there, of 87% across electorates. Now, that's just for new adult patients who don't hold concession cards. Does that sound like a fair representation?
It does, actually. I think that feels like about right from what we've seen on the ground.
Okay, so you're a GP that practices in Western Sydney. That bucked the trend somewhat. There were 9 electorates out of this report that had a bulk billing rate of above 75%, all of those located in Western Sydney. Why are you able to offer bulk billing?
Western Sydney, and especially the area we're in, which is Mount Druitt, is probably a little bit different. And so this particular trend overall and the specific statistics from Western Sydney really just tell you the story of Western Sydney, not the story of bulk billing. So more specifically, Western Sydney has got a very interesting general practice demographic, and that's probably something which is worth mentioning. So one of them is that the doctors there are generally older. We're talking a lot. I think we're looking at our last statistic of about a quarter or so who are over or well over the age of 60.
Okay.
We've also got a higher number of solo practices, which were often established by doctors more than 30 or 40 years ago. And so we're looking at about 37% of practices or so, which are actually solo practices. And that's a rather interesting thing, because I suppose the thing to say about the bulk billing or the rebate is that it's not the doctor's income. It covers everything. And the biggest costs which a practice will incur are rent and staffing, both of which have gone up substantially. But if we're talking about doctors who've been there for 30, 40, 50 years sometimes, they've probably already owned their own premises.
Right.
So therefore the rental side is less of a thing, so they're able to do it. But there's another factor, which is the fact that if they're coming to their last few years of their working life, sometimes the transition away from bulk billing is just that much harder. And so for them, it's easier to just say, we'll take a bit of a pay cut, we'll stick around for a couple of years, and when it gets too hard, we'll stop working.
Yeah,
so
it's interesting, isn't it?
Yeah.
Is there also an element there that given if they're just one doctor practices and they've been in the community for quite some time, they're more embedded in that community and there is a loyalty factor?
There is a huge factor for that. And that's another thing which is not unique to Western Sydney, but is certainly very prevalent in Western Sydney, in that we are seeing doctors there who are often from those communities and have grown up in those communities, so to speak. So there is a very strong community element to that, which does make them feel a little bit more responsible for the community.
We know that back in November the government had a major overhaul to Medicare to incentivise doctors to bulk bill more. Did you notice a change to the way that you operate or your colleagues operate with this overhaul back in November?
So certainly if we were going back to earlier in the past, so earlier, say, beginning of last year or even the year before that, there was much more talk, even among the older doctors, of moving away from bulk billing everyone. And so having the triple bulk billing incentive, which is for pensioners, healthcare card holders and children under 16, really did make a difference, and it tipped the tables a little bit in these regions, especially where there's a more disadvantaged community.
Because we put a question to the government with respect to the findings of this report, and we sought their comment, and they said that, you know, since the overhaul, GP bulk billing rates have actually risen 2.1% in the first 2 months. Do the government numbers paint a fairer picture, or does this information from Clean Bill paint a picture? What are people meant to do with this?
Yes, so both figures are probably right, and the problem is how you look at the figures. So if you're looking at the figures in terms of total numbers of consultations which are bulk billed, it is actually quite likely that those have increased, because there will now be children who are getting bulk billed, pensioners who are getting bulk billed who were not before. However, the problem is that this group, as in pensioners, healthcare card holders and children under 16, are still not the entirety of the population. So we may very well be seeing a situation where there'll be a growing gap for those who are not healthcare card holders, children or pensioners, and there'll be bulk billing available for a select group.
So just briefly before I let you go, and this is probably a question that you could speak ad nauseum on, where does the government then need to start to continue with policy for broader health reform? What does good broad health reform look like?
I think the first thing to say is that bulk bill, Medicare, has been around for over 40 years now, and it served us well. It has ensured a degree of access and really allowed us to provide good health care to all Australians. The problem, of course, is that things have changed in 40 years. And in those 40 years, there's much more which has been able to be done from a chronic disease management perspective, much more which can be done from a preventive health perspective. And this is not where Medicare is at its strength. So we do need to look at reforms to the way that chronic disease is managed. We do need to recognize that the needs are more complex, say, in some communities. So, for example, in my area, in my practice, we have one new diagnosis of diabetes every 2 weeks. And we know that diabetes, for example, is one of those things which is going to require a lot more time. And so having the same consultation value for a child with a cold versus someone who's got diabetes, heart disease, and kidney disease, which actually represents about 10% of my patients, is actually very different. So we are not really either incentivizing or supporting the sort of care which is needed for complex patients.
Dr. Kien Seng Lim, thank you so much for joining us here on Weekend Breakfast. Some really interesting insight there.
Thank you very much.